Hi, I'm Andrea, and welcome to Conversations We Need to Have. We are a sex and relationship podcast where we encourage you to be bonobos, not chimpanzees, be lovers, not fighters. Now, today we're talking about something that makes a lot of people feel uncomfortable: erectile dysfunction, or ED. It's more common than you might think. It affects around 1 in 5 men in the UK. That's over 4 million people. And yes, that includes younger men too. Rates have actually doubled in the last 25 years. So, what is it? ED is when someone can't get or maintain an erection strong enough for penetrative sex. But here's the thing, it's often a symptom, not a problem itself. It can be linked to physical health issues like cardiovascular disease, diabetes, high blood pressure or cholesterol, and prostate problems. Or it can be psychological: stress, anxiety, depression, relationship tensions, all of which can affect performance. Sometimes it's a mixture of both. And that's why I like to call ED early detection, because it's often your body's clue that something else needs attention. If it happens, the first step: go to your doctors, rule out any medical causes. Then, if needed, explore sex therapy or counseling, especially if performance anxiety has crept in. So an example of a psychological issue with ED could be man goes out, meets somebody, they've had lots to drink, they go back to they start getting it on, and then he can't get an erection. So then what happens is next time he will go out, meet someone again, okay, and then he comes back, and then his thoughts are, gosh, what if I can't get an erection? Oh my goodness, what if it happens again? And guess what? It happens again, because body and mind work together. It's psychosomatic. Okay, so then this starts becoming a problem. It's also important to know, as men get older, their erections are not as hard. So look, if I use my hand, again, this isn't going to be great for people who are just listening, but I'll try and explain as much as possible. If I put my hand up in front of me and spread my fingers, and then what we've got, let's say the little finger, that is very upright and erect, that's our teenage erection. And then the finger next to that becomes our 20s. Yeah, still quite good. And then as we go along to our middle finger, that's our 30s. It's still pretty good and strong and up there. But as we go along to our 30s and our 40s and our 50s, the erection isn't as strong, but it's still good enough. It will still do the job it's meant to do. Now, Kegel exercise can help strengthen your pelvic floor muscles. These muscles help strengthen the bladder and the bowel and improve sexual functioning and contribute to harder erections. You can Google Kegel exercises, but actually a good idea might be to get in touch with a sex therapist to give you more understanding, and the whole program can be tailored to your specific needs. Viagra is a brand of drug which is used to treat ED, increasing the blood flow to the penis, helping it create an erection. It takes about 30 to 60 minutes to be effective. You can take it up to 4 hours before having sex, but remember, it only works if there's arousal. It's not a magic switch. There can be side effects such as dizziness, headaches, and feeling sick. You also need to check if it's safe to take along with other medications. If penetrative sex isn't on the menu, there is still a whole world of connection, such as flirting, touching, kissing, massage, dancing, cooking together, exploring new sensations. Did you know that the skin is the biggest organ and can be very sensitive? Most couples will just explore breasts, chest, bums, and genitals and head straight for penetrative sex, missing out on a whole load of fun. So I have one lady who came as part of a couple, and she was talking about when her partner touched her behind her knees, and the effect that had on her sexually was quite amazing. It might help you to remember lesbians have great sex lives and there isn't a penis in sight. ED can actually become a doorway to better intimacy when couples stop equating sex to just penetration and rediscover play, pleasure, and connection. So if you're experiencing ED, see your doctor, consider sex therapy, solo or as a couple, and remember your sex life isn't over, it's just evolving. And remember, be a bonobo, not a chimpanzee. Be a lover, not a fighter. And thank you for listening. Take care of yourself and keep having the conversations we need to have. And as always, if you enjoy what you hear, please rate, like, and subscribe. It really helps these conversations to reach the people who need them most.